What is going on? We're back. We're going to get into some respiratory system review. What are the parts of the upper airways? That's right. Remember, the upper airways include the mouth, nasal cavity, and nasal pharynx. What is the function of the upper airways? That's right. The upper airways clean and filter the air, removing dust, pollen, viruses, and bacteria. What are the alveoli, and what is their significance? That's right. The alveoli are small sacs in the lungs where gas exchange occurs. They're significant because they're the smallest surgical unit that can be removed. Explain the mechanics of breathing during inspiration. That's right. Remember, during inspiration, the diaphragm contracts and moves down, while the intercostal muscles will pull the ribs up and out, increasing chest volume and allowing air to flow into the lungs. Describe the role of pleural membranes and pressure in the respiratory system. That's right. Remember, the pleural membranes form a lubricated cushion around the lungs, maintaining negative pressure in the interpleural space to keep the lungs inflated. What is the difference between normal and forced expiration? That's right. Okay, just remember normal expiration is passive, it relies on relaxation of muscles. Forced expiration involves active contraction of muscles to expel air more quickly. How does surfactant contribute to lung function? That's right. Remember that surfactant reduces the surface tension in the alveoli, preventing them from collapsing and easing the process of breathing. Name two conditions that can interfere with normal respiration and briefly explain their effects. That's right. So remember, asthma and emphysema are two conditions that can interfere with normal respiration. Asthma causes inflammation of the bronchioles, leading to increased airway resistance, while emphysema results in the loss of lung elasticity and destruction of alveoli. How does the structure of the respiratory airway contribute to their functions? That's a good question. That's a good question. Right on. Remember, form follows function. Form follows function. The structure of the respiratory airways, including cilia, goblet cells, and smooth muscle, helps in warming and humidifying air and filtering out particles before it reaches the lungs.